Airway management continued. Nurse Marks has determined her patient is in need of trach suctioning. She has gathered all her supplies and donned PPE equipment correctly. She will now provide for a safe environment and provide patient privacy. She will use good body mechanics and ensure patient safety.
Mr. Smith, I'm going to go ahead and raise the level of the bed. Please let me know if you are feeling uncomfortable by doing a thumbs down throughout the procedure.
Nurse Marks has verified her patient with 2 patient identifiers and ensured that the patient has a way to communicate. She will now place a chuck or a towel across the patient's chest. The bed has been raised and the client placed in semi-Fowler's or Fowler's position. Increase supplemental oxygen if appropriate. Open suction kit. Pour normal saline into sterile basin. If patient cannot breathe spontaneously, ventilate patient for at least 1 minute. Remove gloves and perform hand hygiene. Don sterile gloves. Connect sterile suction catheter to suction tubing. Turn on suction. While applying suction, dip catheter tip into sterile saline. Insert catheter through tracheostomy until resistance is met or patient coughs. Withdraw catheter 1/2 inch. Suction intermittently for 5 to 10 seconds, releasing airflow through catheter's vent and rotate catheter. If needed, ventilate airway again, then rinse catheter. Disconnect and discard suction catheter. Turn suction off. Remove stoma dressing and discard it. Remove chuck or towel and discard. Remove suction equipment and gloves. Perform hand hygiene. Always remember to educate your client.
Mr. Smith, I have just performed tracheal suctioning. How are you feeling at this time? Thumbs up if you are okay, thumbs down if you're having any difficulties. Patient has given me a thumbs up.
Now open trach care kit. Pour normal saline into sterile basin. Don sterile gloves. Position drape on patient. Next, pre-moisten the cotton tip applicators. With your non-dominant hand, remove the inner cannula. Place in normal saline to soak, if not disposable. With brush and normal saline, clean lumen and outside of inner cannula. Remove excess normal saline. Fold pipe cleaner in half and use to dry inside of cannula. Reinsert inner cannula following curvature and lock into position. Clean outer cannula and stoma with cotton tip applicators. Clean stoma in circular motion from stoma site outward. If secretions have dried or are difficult to remove, use half-strength peroxide solution. Pat dry area with gauze, making sure not to leave any threads. Stabilize trach tube with one hand. Place fenestrated gauze under flange.
Mr. Smith, please give me a thumbs up if you're okay, thumbs down if you're feeling any discomfort. Patient has given me a thumbs up.
Replace trach ties. Keep old ties in place until new ones are securely fastened. Ensure proper fit. Reassess client. Remove and discard your equipment.
Mr. Smith, I'm now going to take a listen to your lung sounds and reassess your oxygenation. Patient has given me a thumbs up.
Ensure patient safety to make sure side rails are up at all times.
Take a deep breath in for me. And again. Mr. Smith's lung sounds are clear bilaterally. His oxygen level saturation is reading at 99% on room air at this time.
Remove your PPE correctly and document care provided.